Hello. Thank you for being here. Thank you for allowing me to be here today. I come to you from Hurley Medical Center. I'm a respiratory therapist, and I'm the lung health navigator at Hurley. Before I get started sharing about lung cancer screening and the importance of prevention and early detection, I heard about this event and read the initiative and the national goal to reduce cancer deaths by 50% over the next 25 years, and it got me pretty dang excited because of what I see at the hospital. And when it comes to lung cancer, I see a lot of patients that qualify for lung screening and for whatever reason didn't get screened, and I can only imagine the what if. Well, what if this person did get screened, the difference it could have potentially made in their treatment and their outcomes. So awareness is why we're here today, and that's why it's important. So I think we can all help meet that initiative. So lung cancer is the leading cause of all cancer deaths. Annually in the U.S., it kills more people than prostate, breast, and colorectal cancers combined. Cancer 5-year survival rates for those same cancers: prostate is 98, breast is 90, colorectal 64, and you see lung at 24%, lagging well behind. It's a super hard cancer to catch early, as with a lot of cancers. However, it is the newer kid on the block, and that number in 2017 for lung, it was 18.6%. So we're coming up, we're gaining ground, we just have a long way to go. So how do you improve those survival rates for lung cancer? You can improve through prevention and early detection. Prevention, these things can increase our risk of getting cancer, any cancer. Tobacco smoking, excess body weight, alcohol consumption, ultraviolet radiation exposure, poor diet, pathogenic infections, and physical inactivity. We all know smoking affects the entire body, not just lungs. It affects nearly every organ in the body. 80 to 90% of lung cancers are due to smoking, but there are people that get diagnosed with lung cancer that have never smoked and never been exposed to secondhand smoke. Now, primarily there are two ways to catch lung cancer early. It would be incidentally or through lung screenings, or in other words, accidentally or on purpose through lung screenings. So when someone has signs or symptoms of lung cancer, they would go to their doctor. Their doctor would order a CT scan or some imaging. When it's found then, once symptoms have started, it's usually already advanced and already spread by then and gives less treatment outcomes and a less chance at a better for survival. So accidentally would be the other option, and that's done any imaging that you would come in and get done. They did it for other purposes, but by the way, you have a little spot on your lung that the radiologist recommended you get that followed up on. Now that's important, especially for high-risk people. You're high risk if you smoke, used to smoke, or you have a family history of lung cancer. We place a little bit more attention on that category of people who have had imaging at Hurley. So what I do is I make sure that your doctor gets that report. I send them a little alert, lung nodule alert. Your patient's higher risk. This is the recommended follow-up. And the problem is those spots on the lung, they're very common. In fact, 50% of people, it's estimated, have them. Sometimes they come and go, sometimes they stay there, they never change. They're from old infections, they're for whatever reasons. But potentially, it could be a lung cancer. So it's important that we follow those and track those. And so then I would send a reminder when that time, say the recommendation was a 6-month follow-up. We make sure your doctor gets a reminder it's time for that. If you don't have a doctor, then I would notify you directly myself that while you were in the ER, you had that finding on your CAT scan. Lung screenings, I'm going to talk about that in detail. Before I do, let's talk about the importance of early detection and lung cancer. On the left, at the bottom, those are stages 1 through 4 with some substations in between, but to keep this simple, if it's caught in its earliest stage, infant stage, before you would ever even know you have it, you can get curative surgery, and the outcomes are much better. As it continues to grow, get bigger and spread, the outcomes are much different with less treatment options, and the survival rates lessen. So lung screening with low-dose computed tomography, or LDCT, is a painless, non-invasive procedure used to detect lung cancer in people who meet certain high-risk criteria. It is the only recommended screening test for lung cancer. Because it is done yearly, you are entered into a program where it'll keep track of and compare your exams. Why should I get screened? Studies have shown that screening those at high risk with low-dose CT scans before symptoms appear can find lung cancer early when it is easier to treat and more likely to be cured. Who should get screened? If you're between the age of 50 and 80, and you're a current smoker or former smoker who was quit within the last 15 years, and you have a smoking history of at least 20 pack years, you would qualify, and it is recommended that you get a low-dose CT scan. Now, what is pack years? That's a calculation done taking the average number of packs per day multiplied by the years smoked. So, for example, a half a pack for 40 years would equal 20 pack years. A pack a day for 20 years would equal 20 pack years. Or 2 packs a day for 10 years would be the equivalent of 20 pack years. How is a lung screening done? You would lie on your back on the CT table. You put your hands above your head. You take a deep breath in as the scanner moves into the opening, and on the way out, you exhale and you're done. So it takes less than 60 seconds to complete that. There's no pokes, there's no dyes needed or necessary for this, and there's really no special instructions. You can eat before and after. The only thing you would be asked to take off any metal, whether on your clothes or on your body, that would be affected by the imaging. Will my insurance cover this exam? For most people who meet the high-risk criteria, low-dose CT screenings are covered every year by Medicare and most private insurance plans, 100% with no out-of-pocket costs, just like mammograms and other screening tests. From my experience, I've been doing this since the inception of lung screening. Locally, all the insurances cover this. Some require prior authorizations, some don't, but that's something the office will take care of, and you shouldn't have to. So if that's me and if I want to be screened, well, what do? The first step would be to make an appointment with your doctor. This visit will be a time to determine your eligibility and document that, and discuss screening further so you're making a fully informed decision. That's called a shared decision-making visit, and that is required. And it's a chance to go into things further and cover the what-ifs. Well, what if something is found? Then what happens? And they'll talk about different procedures they would do to determine if that's cancer or not. But mainly it's a once-a-year study. Sometimes they want you to come back sooner, similar to mammograms. By the end of that visit, a referral would be placed, and you would get scheduled for your appointment. Screenings are done everywhere in our county, all the hospitals, and pretty much all the imaging centers do lung screenings. So in closing, lung screening needs to catch up. The current national screening rate for those who qualify is only 5.8%. That lags way behind the other screenings that are done for cancer. If it's estimated that if everyone got screened that qualified, we'd save 48,000 lives a year. And part of the reason is lung screening is the newer kid on the block. It's only been around since early 2016. It's because of its effectiveness. Insurance has started covering that. Once Medicare starts covering it, it's proven effective, and then the other insurances have followed. And my personal experience, we've caught lots of lung cancers early and had better outcomes. So overall, we're heading in the right direction, even though we have a long way to go. In the last 5 years, new lung cancer cases are down, early detection rates are up, there are more treatment options than ever before, and survival rates are improving. So I want to leave you with today. Today was a call to action, which I loved when I read the initiative of reducing cancer deaths by 50% over the next 25 years. For someone like me that deals with it on a regular basis, it's more real. And it starts with spreading the word. A lot of people don't know about lung cancer screening, and that's not only in our community, that's also in the medical community. It's still being recognized. And so let's all raise awareness so we can reach that national goal. And if this didn't pertain to you today, as far as you're not a smoker, but if you know somebody who does, just say, hey, did you hear they have lung screenings? Or have you ever gotten screened for lung cancer? Raise awareness, that's what it starts, and we're all in this together. So if I can answer any questions later on, I'll be at my table over here. I'd be more than glad to talk with you one-on-one, and it's my pleasure to be here today. Thank you for being here today.